Okay. Thank you for joining us today for the Geriatric Grand Round program. This program is provided by the Michigan Center for Rural Health in cooperation with the Geriatric Education Center of Michigan, MSU College of Human Medicine, and the MSU College of Nursing. Before we begin, just please remember to keep your mic muted until the Q&A component at the end of the presentation. Please remember to mute your mic after you've asked your question so the signal is clear and other sites are not listening to your conversations and so the presenter can answer your question. Handouts are located on our website at www.mcrh.msu.edu. Click on the education link on your left, scroll down, click on Geriatric Grand Rounds, and then find today's date. There you will see the attendance forms and the evaluation link. Continuing education is available for physicians, nurses, and social workers. Please note that there is a new process for nurses. You have a kind of like a rule sheet, and that you need to handwrite in your name and your site name, and you need to manually sign everything. Each the attendance forms or sign-in forms need to be emailed and faxed or mailed into the Michigan Center for Rural Health office. Sign-in sheets must be signed by a proctor and they need to be returned to the MCRH office or you will not receive credit. And the online evaluation must be completed. These forms need to be completed within 2 weeks or by March 16th. Physicians, please note that in order to obtain your certificate, you need to do this through the CME portal. Our speaker today indicates no conflict of interest, and the planning committee did not have any conflicts. There is no commercial support for this program. I am pleased to introduce Brenda Roberts, who will be speaking on in-home and long-term care services and who pays. Thank you.
Thank you. Hello, everybody. It's a pleasure to be with you today. I'm going to start with a real brief introduction of myself and tell you a little bit about my background. I am currently employed.
Do you want me to switch over
To
your presentation?
Yes, please. I didn't know they could see. Thank you. Sorry about that. Just catching up with the technology. I'm currently employed with Michigan Assisted Living Association as the Director of Quality Assurance and Education. Previous to my position, I've worked on part of a senior executive management team for assisted living communities. I served as Michigan's state long-term care ombudsman, as the state's lead advocate for persons in licensed long-term care. I've been a statewide trainer for the Medicare Medicaid Assistance Program, the My Choice Waiver Program, and service manager for home and community-based services, as well as an adult foster care administrator. The only reason I highlight this information are these are all topics we're going to talk about today and have had some personal experiences that I can share with you. This is a very high-level global review of various services, and my contact information is provided. I am more than happy to talk with you further after the session via email or phone call if you'd like more information or help. I thought we would start out by looking at cost of care in various settings across the state in Michigan. And I won't go through and read every one of these, but these are the sorts of services we're going to take a look at today. And you can see the price range, sort of the minimum and maximum. And of course that varies depending on where you are around the state, but that'll give you an idea of costs. First, I know we have some Area Agency on Aging staff with us, and thank you for joining us. I do want to tell folks that that's a great first place to start. It's a nationwide network of not-for-profit agencies that was created by Congress, and their goal is to be the one-stop shop for senior information for older adults. There are 16 area agencies on aging throughout the state, and I've provided you with a link so that you can go to the state map and take a look at your area and find the area agency in your community. In addition, if you want to find area agencies on aging outside the state of Michigan, I've provided the 1-800 phone number for Elder Care Locator, and you can obtain that information from them. All right, I'm going to start out first with sort of looking at a progression of if I started to need services in my own home and then maybe eventually beyond having to leave my own home, what services are available. I'm going to start by talking first about private duty or non-medical home health agencies. It's no surprise that we are seeing an unprecedented growth in the senior care industry, specifically home health agencies, because beginning January 1st of 2011, we are having 10,000 people a day turn 65, and this will continue until 2030. Currently, it's important to know that currently in Michigan, the state of Michigan, there are no required performance standards or licensing requirements for private duty non-medical home health agencies. So just like with any other program that we're going to discuss today, I always advise seniors, older adults, to use due diligence in selecting home health agencies, assisted living, any nursing home, any of the services that they're going to be considering. I'm going to talk a couple of minutes about Medicare and Medicaid and what the difference is, and then we're going to talk about who pays for what in your own home or other settings. And of course, why did we ever name Medicare and Medicaid so closely? In the course of our business, those of us who know the difference between Medicare and Medicaid, we still get tangled up in it. Well, then the older adults we work with definitely get the two confused, as well as their kids. So very, very quickly, a high-level review of Medicare. You have to be 65 years of age or older, disabled in receiving Social Security benefits for 2 years, or have end-stage renal disease or ALS or Lou Gehrig's disease in order to be eligible for Medicare. Medicare has a Part A, which is considered the hospital insurance. It's typically, again, this is high level, we could get into who has to pay for Medicare Part A, but typically it's premium free if you've worked enough quarters. It's your hospital, covers hospital, home health, and skilled nursing. And it's important to remember that pays up to 100 days in skilled nursing. Part B, medical insurance, is considered medical insurance, or more or less your outpatient. The premium typically is $104.90. We're seeing more variance in this year because anybody who was previously on Medicare, their Medicare premium was frozen this year because there was no cost of living to their Social Security benefits. Anybody new enrolled to Medicare will pay a higher premium, and those persons with higher income also pay a higher premium. So the types of things that Part B covers are your doctor visits, your lab visits, and your home health services. You'll see that that's both under Part A and Part B, the home health. Part C is a Medicare Advantage. Part A and B is often referred to as original Medicare, and Part C is Medicare Advantage options that would include services in both A and B. And then Part D is prescription drug coverage, and the premiums vary there as well. Now, people with original Medicare, it has copays and deductibles, so most people do purchase Medigap policies. Okay, so that's Medicare. Medicaid is a federal state program funded by federal and state and local taxes. There are many different types of Medicaid, but today we're talking about the Medicaid program for aged, blind, or disabled, and aged is considered 65. And the Medicaid programs we'll be talking about, it's based on income and assets, and we'll again discuss that at a relatively high level. Medicaid is administered by the Michigan Department of Health and Human Services, and I've provided you with a link so that you can find your local office. Okay, Medicare covered home health services. Okay, so that's the first thing that we're going to talk about is services you can receive in your home health services. And I know some are providers of home health services in this, so this part is old news to you, but service provided under Medicare home health would be such things as skilled nursing, physical therapy, occupational therapy, speech therapy. You can also have home health aides and medical social services. I've indicated those are not standalone services, which means you have to have a skilled service coming in order to receive the home health and medical service as well. Your cost in original Medicare Part A and Part B would be zero for any approved home health services. Now, unlike non-medical home health agencies, a Medicare home health agency must be Medicare certified, and there are rigorous standards that must be met. You must also have a doctor's order, and the person must be considered homebound. I've seen over the years, I remember people talking about, well, what if I go to church, or what if I go get my hair done? Will the Medicare police report me? That sort of thing. That's not the case. People may leave their home for medical treatment or short, infrequent times. I had a person once whose daughter came from out of town and wanted to take her to Big Boy for a hot fudge sundae, and she was all upset because she couldn't leave her home in order to get these services. So that's not quite that stringent. In addition, there's some additional notes there about the ability for your therapies. That another addition that's new is, it used to be back in the olden days that you had to see improvement in order to be eligible for those physical therapy, occupational therapy, and we now have it covered if the person is working to maintain their current level. So that's a plus. Oops, I went the wrong way, I'm sorry. If you're looking for a home health agency, there's a website for everything, right? Well, for this one is Medicare Home Health Compare, and I've provided the link for you, and you can locate these Medicare certified home health agencies, and then you can find some information on specific performance standards for them too. So that's your website for that. There are also Medicare Hospice benefits, and in order to be eligible for Medicare Hospice benefits, you must have Medicare Part A and meet the following conditions. Your hospice, your doctor, either the hospice doctor or your regular doctor, must certify that your life expectancy is 6 months or less, that you're willing to accept palliative care instead of care or cure for your illness, and you sign a statement choosing hospice care other than other Medicare covered treatments for your terminal illness. Your Medicare hospice benefits include all items and services needed for pain relief and symptom management, your drugs related to your terminal illness has a $5 copay, certain durable medical equipment is covered, aid and homemaker services are covered, spiritual and grief counseling, as well as all other services usually covered by Medicare. For Medicare hospice benefits, you can obtain hospice care in your own home, assisted living, or a nursing home. However, hospice does not cover the stay or the room and board in the facility. Again, here's the website. If you're looking to find a Medicare certified hospice, there's the link to find that information in your own local community. Then, okay, now here's another one of my favorites. There's Medicaid and Medicare that's so closely the same, sound so close to the same. We just talked about Medicare home health. Well, now we're going to talk about Medicaid home help. Now, Medicaid home help is administered by the Department of Health and Human Services, and it's designed to support people in their own homes. And people who are eligible, of course, have to be on Medicaid and need physical help with at least one activity of daily living. And I've provided a link that link on this page will give you a brochure that will provide more information about this program. Services provided by Medicaid Home Help would be things like helping the person with eating, using the toilet, bathing, grooming, dressing, moving around the house, taking medications, meal prep and cleanup, shopping, laundry, and light housework. How this program works is who provides the services. The client or you employ your own provider. So the person receiving adult home help employs their own provider. And so it's important to know providers are not DHHS employees or State of Michigan employees. You may hire a friend, relative, neighbor, or a home health agency. The only situation you really can't do is your spouse cannot be paid to provide services to you. How much is a provider paid and how much services you will be provided is based upon a comprehensive assessment. So a social worker type person will come to the home and do an assessment, and based on an individual person's needs, they will be given a plan of service, how many hours, and depending on the geographic area, the hourly rate of pay. Again, Medicaid Home Help, it's administered through the local Department of Health and Human Services. If a person already has Medicaid and wants home help, they call the Department of Human Services. And you may be familiar, there's sort of two sides to the Department of Human Services. One's your eligibility specialist who determines if you're eligible or not. And the other side is the Adult Services Unit. And you may be familiar with them with Adult Protective Services. But they also manage and administer the home help program. So you would contact the Adult Services side of the Department of Human Services for an application. It's much easier to apply for adult home help than to apply for the Medicaid itself. So again, there's that link to get you to your own Department of Health and Human Services. Next, we're going to talk about adult day centers. And adult day centers provide respite care for caregivers and socialization for persons requiring supervision. Sort of like the non-medical home health agencies, there are no licensing requirements for adult day centers. Some, however, receive funding from Michigan's Aging and Adult Services Office, and so those who contract with Michigan Aging and Adult Services, they must meet specific operating standards, okay? So unless you are contracting or an adult day center is contracting with the Aging and Adult Services, there are no particular licensing rules or standards that must be met. Some adult day services are funded by two Medicaid programs. The first is the PACE program, which means the Program for All-Inclusive Elderly Care. And the other program is the My Choice Home and Community-Based Care program, Waiver program. And I will talk about both of those in a few minutes and provide you with additional information. Adult day services, sources of payment. If I needed services, there are grants available through the area agencies on aging in some locations for adult day services. There are some grants from other organizations. For example, in my home community, our local foundation helps contribute to the adult day services program to make it more affordable for those who are using it. Some local senior millages may be used, and sometimes some long-term care insurance policies will be can be billed and cover services. Medicare does not cover adult day services. To locate an adult day center, you can call your area agency on aging, and of course they will probably have a listing of all of them, but certainly the ones that receive any grant money. And then in addition, there's a Michigan Adult Day Services Association, And so there you might find additional ones that are strictly private pay. And again, I encourage you to look at that table I provided at the beginning in terms of costs and see what these various services are actually costing people. Okay, the Medicaid My Choice Home and Community-Based Waiver Program, one of my favorite. Had the opportunity way back in the 80s to work and pilot this program in the state of Ohio, and moved back to Michigan and waited 10 years before it finally came. So I just love the waiver program for the options and services that they provide for people who would otherwise have to live in a nursing home. So the My Choice Waiver Program is a long-term in-home care program to provide services to older adults as well as persons with disabilities. Services can be provided in your own home, the home of another, like your daughter, son, whomever. The services can be provided in an adult foster care home or a home for the aged. The My Choice Waiver Program eligibility, again, sort of at a high level to give you an idea who might be eligible for this program, are people 65 and older, or persons with 18 years of age and older with a disability. Now, the income can be no greater than $2,199 a month, and that's a gross income, not a net income, so no deductions. It says have no assets, and you'll see it greater than XXX for single persons, and special rules apply for married couples. The reason I put XXX is typically if you ask someone regarding Medicaid eligibility for an older adult, a single person, they will say, well, you can have $2,000 in countable assets. But the important word there is not the 2,000, that's what people hone in on, but the countable assets. And so I hate to just throw numbers out there because people rule themselves out for services that they might be eligible for or closely eligible for, which, they might be able to spend some resources for their care and then become eligible. But with that being said, typically $2,000 in countable assets. However, the homestead is excluded, and a homestead is considered the home and any contiguous property. So if it's the family farm that's across the street, all of that, that would be excluded. Sometimes you might have properties that are not saleable because, I would hate to have somebody think, I can only have $2,000, but I have that, rustic cabin up north. Well, my brother's name is on that cabin too. Well, if it requires my brother to agree to sell it, and he's not willing to sell it, that's not a countable asset because it's non-saleable. And so I just caution people to really be careful on just cutting them off at that $2,000 you can only have point, because there are a lot of exceptions. And I'd hate to see somebody not get services because, they just weeded themselves out. Always the best thing that a person could do is really, in my opinion, offering an opinion here, is to see an elder law attorney. And again, an elder law attorney rather than just any attorney, simply because, they have different practices and expertise as attorneys. So the attorney they saw many years ago for their divorce and they have a relationship, may not be the best attorney to see in relationship to long-term care planning. And I don't think that a lot of people really think about an attorney for long-term care planning. They think of it more, and elder law attorneys encompass that under estate planning. But I think a lot of older adults don't consider estate planning for my long-term care as well. So back to the eligibility requirements for the My Choice waiver. To be eligible, you have to be a nursing home resident and need support to return to your home or another's home, or return to an adult foster, or go to an adult foster care home or the home of another. If you're not in a nursing home, you must be physically eligible for nursing home placement and need support to stay in your own home. So again, the My Choice Waiver Program is all about helping people stay in their current living situation, if it's their own home, another's home, adult foster care, or home for the aged, rather than having to go into a nursing home. So it's either a person who's on the verge of going to a nursing home or would be medically eligible for a nursing home or in a nursing home. And of course, that would probably result in the next one, which have difficulty or unable to perform basic activities of daily living, such as personal care, bathing, housekeeping, all those sorts of things. Here's a long list of the My Choice Waiver Services that an individual could get. And you'll see it has adult day health, the chore services, counseling services, and I won't read them all through. You can read those yourselves. But it's quite a comprehensive list. Medicaid My Choice Waiver Providers, the local area agency on aging is one of the waiver agents or providers, and that each region has a second waiver agent as well. And to find your waiver providers in your area of the state, I've provided that link for you. Okay. Veterans benefits, including aid and attendant care, is something that is a program that will help pay for services in a person's own home as well as in like adult foster care, home for the aged. I'm not going to go into all the benefit requirements for the veterans programs because there's a variety of programs. However, I have provided you with a link to programs offered to older adults through veterans on this slide. Now, one thing I do want to share with you that I've learned, I always learn things the hard way, usually by a mistake I've made. So one of the things that I've learned over the years is to really exercise caution when seeking assistance for applying for benefits for a veteran. First of all, if someone approaches an older adult or any person or yourself offering to help apply for veterans benefits, first of all, you cannot charge. The person cannot be charged for helping a veteran apply for benefits. Okay? So, sometimes you will see an organization who will approach older adults, in some sort of setting and say, we'll help you apply for aid and attendant care or other veteran benefits. And these people know the veterans benefits and know the eligibility requirements. Now, why would they be out there on the, knocking on the pavement, looking for people to help apply when they couldn't be paid for this service they're providing? What they can do is they can sit down with the older adult, review their finances, and then help them configure their assets in order to become eligible. And sometimes that might be something, for example, might be sell them an annuity. And so you have this annuity or whatever set over here, some financial vehicle now, and it's irrevocable. They restructure your finances. And you're eligible for veterans benefits. And you're like, woohoo, I'm eligible, I got my veterans benefits. And then as your care needs increase, and it's more expensive than what your veterans benefits are even covering, or perhaps you go to a nursing home, and you find yourself in the situation that you need Medicaid. Well, that person who helped you with your veterans benefits looked at your assets strictly from a veterans benefits perspective and may have helped the person structure to win those benefits or be awarded those benefits, but may have done something that would be considered divestment or tied up the finances in something that would not be acceptable for Medicaid. So you really have to be careful who you have help with apply for veterans benefits. My suggestion is going to an elder law attorney again, elder law attorney who would both know the veterans benefits as well as the Medicaid benefits. I'm talking about elder law attorneys so much, I think maybe they should give me a kickback or something, right? The elder law attorneys. Okay, now I'm going to look at, okay, we talked about some Medicare services. We've talked about Medicaid services in your own home. Now I'm just going to talk about, okay, so I've gotten to the point, my house is too big. I just feel like I need to get out of my house, the older adult. So some things that I've provided here to take a look at. It's been fun recently to watch this. On the slide, you'll see the little house. I don't know if you've seen this in your world or not, but these are med cottages, and they are designed for older adults or persons with disabilities, and some have some technology, and they're modular, and so you can like put one in your backyard for grandma if you wanted to. So there's these new modular devices, which are really, I thought, just new and cool, these new modular homes. And as you can see, this particular one I just cut and pasted from a site that does this med cottage, and this particular one is approximately $40,000. So, and I think we're also seeing, at least from my personal experience, seeing more of the trend towards multi-generational households, whether it's the younger person's family, maybe a divorce and the younger child returns home, young adult child, or if it's the older adult needs some help and they're going to the child's home. My own personal situation is that we've recently built a home with our adult daughter and her husband, as my husband has dementia. So we've had to look at some of these kinds of things ourselves. So this has given me a whole new perspective on how to, at looking at these things. Then, of course, there's always the choice of apartments, and I'll talk a little bit more about that. Trailer parks or modular homes. I talk to older adults when they're, looking at, I don't think I can stay in my own home. Home shares, I've seen a few. These typically, they're not, I haven't, again, my personal experience hasn't been to see a lot of these, but I have seen a couple of older adults come and live together, and so they've done a home share. I had one lady in particular who had a college student. She was a pretty independent lady. Around the house, she was independent. She didn't really like living alone, so she provided an affordable room to a college student, and she loved having that young person in the home and just coming and going, that sort of thing. Of course, you can live with a family member in their house or your house. I always, when I talked with older adults about getting an apartment or downsizing to that trailer or that modular home, I talk with them about, and I'm sure your personal experience has been the same, that if they're in the apartment that has the private entrance and exit, that doesn't go into like the community room or whatever, that you can become just as isolated in an apartment setting. Or sometimes people go to the trailer or modular home park, less yard to keep up, less house to keep up. But if the day comes to that you're homebound, when you're in that apartment with a private entrance or that modular home, you can be as isolated as you would be many miles out in the country, because if you can't walk out that door and walk outside to get to where the community room is or the neighbor is, you can be just as isolated. So those are important factors to consider. When people are considering downsizing to apartments, there are some income-based apartments available for older adults. Again, this is sort of a high-level review, but basically, rent is figured at 30% of the person's annual income, less $400 a year. And then there are additional deductions made for some medical expenses and if there are additional dependents. So the person can at least know that their rent would never be more than 30% of their monthly income as their situation changes. To locate an income-based housing, you go through it's administered by your local housing commission, and I've provided you with a link there so that you can find those resources in your own community. Okay, here's my favorite part to talk about. What is assisted living? Well, in Michigan, assisted living does not have a legal definition. So people say, well, what does that mean to me? Well, what it means is anyone can call themselves assisted living. You know, I could hang a sign out on my front door of my house and say it's Brenda's Assisted Living. Apartment complex can call themselves assisted living. Since the state has not provided a definition, that means you can define what it means. It's primarily considered a marketing term. Okay, now with that being said, there are some laws providing guidance on when you have to be licensed, however. So if you say, is there an assisted living license in Michigan? Well, there's really not an assisted living license in Michigan. However, Public Act 218 says, and I'll read it exactly as it is on the screen, if you provide supervision, personal care, and protection, in addition to room and board for 24 hours a day, 5 or more days a week, and for 2 or more consecutive weeks for compensation, that you have to be licensed. Okay? So, if you're licensed, so if you are providing, my next slide says, the 24-hour care, or 24-hour supervision, personal care, protection, room and board, if you're providing all of those services, you must be licensed. And the license types that you could be are an adult foster care home. An adult foster care home is for persons 18 years or older, and there are different license types. There's a family license, there's a small group home. A family license is when the provider lives in the home and serves 6 people or less. The small group home serves 12 persons or less, and the large group home serves 13 to 20. Now, when you think of adult foster care, you probably think of a more residential setting, a typical house with people who live in it. And that would be the case in the family home. However, even in small and large group homes now, we see full apartments or partial apartments with general living areas. And those are adult foster care homes too, but they're calling themselves assisted living because it's a marketing term. When you're talking to your mom and say, hey mom, do you want to look at that adult foster care home down the street that they opened? Or hey mom, do you want to go look at that assisted living? Assisted living just sounds a little bit more palatable. So that's one license type. Another license type is called a home for the aged. Again, Mom, do you want to go look at that home for the aged? You're not going to get the same response as, Mom, you want to go look at that assisted living. So that's why licensed providers have chosen to call themselves assisted living for marketing reasons. A home for the aged is if you're serving 21 or more residents and the residents are 60 years of age or older. So assisted living that does not require a license would be maybe housing with services, but less than 24-hour supervision, personal care, protection, room and board. Okay, so if you're providing anything less than that, you would not need to be licensed. And in some situations where there's more than one entity providing the service. For example, somebody might be renting a private residence, several people have a lease, and a home health agency comes in and provides services, that may not need to be require a license. Anybody who's wondering, can look at Public Act 218 and figure out who needs to be licensed and who doesn't. And then, is an assisted living community that is licensed better than one that does not require a license? People ask me that now that I work with the association all the time. And those folks who work in day centers or home health centers, the same thing might be asked of you in terms of is a certified home health better than, they're different. It doesn't mean they're better or worse. we have such a human factor in our services that we provide that it's hard to say if you're in a licensed community that it's better than being in a community that does not require a license. So that's a personal decision. Most people, when they're shopping, don't realize, they don't know, is this a licensed setting? Is this an unlicensed setting? Is it an adult foster care home, or is it a home for the aged? Because we even have what we call twin 20s, where a provider might come in and build a 20-bed adult foster care home, and it looks like assisted living because it has apartments, and then they build another 20-bed connected to it. And the law allows that, but they hold two different licenses. And so you think, you go into this facility and say, oh, this must be an HF. You say, are you licensed? They say, yes. How many do you serve? 40. Oh, 40 people, you must be an HFA. Well, no, they're an AFC, but they have two separate licenses. So it's sort of, I consider it the beauty and the curse, because the beauty of having such a variety is that, well, the curse is it's hard to compare apples with apples. The beauty of it is I've learned over the years that it's such a value-laden decision where you want to live and how you want to live, that there's a wide variety of options out there. So who pays for assisted living? In the world of assisted living, it's almost exclusively private pay. And I say almost. In the world of older adults. In the world with community mental health and contract homes, that's something different. So I'm talking about those older adults. It's primarily private pay. However, the person can receive My Choice Waiver Program services in that home. So again, the person would have to without those services provided, would most likely go to a nursing home, so they have to be nursing home eligible. And remember, Medicaid also in the waiver program does not pay for room and board or usual and customary services. So those would be the typical services provided by adult foster care home. So they're paying for the extra help that person needs. Then there's SSI, which is Supplemental Security Income. So there are people on those and then there's a personal care supplement to that. Now for those people, those are typically the lower end in terms of payment sources of about $1,100 a month. And so you're talking 24 hours care, 24 hours a day, 7 days a week for $1,100 a month. So typically providers can't afford to take too many folks on SSI in their mix of their home, simply because just like have food and bills to cover. So the SSI person provides some unique challenges when it comes to finding a place for them in an assisted living community. But then there are also those communities who are dedicated to working with the lowest income people. It's important to know that other than the My Choice Waiver Program, Medicare and Medicaid does not pay for assisted living. A lot of older adults are surprised that Medicare does not pay for assisted living. The other thing is some long-term care insurance can pay for assisted living as well. So that's important to remember. Now, homes for the aged and adult foster care homes are licensed by the Michigan Department of Licensing and Regulatory Affairs. So that's something that's been new in the last year or so. They're under LARA. And there is the website link there I've provided. If you go to that link, it's a search engine, and you can look up the adult foster care home or the home for the aged in your community. So you can enter in your city, your zip code, whatever, and then any licensed communities will be available to you on that site. Okay, PACE programs. The PACE program stands for Program of All-Inclusive Care for the Elderly. Another name that's getting sort of antiquated too, right? It's a specifically designed program for persons who would also otherwise live in a nursing home, and it provides all Medicare and Medicaid covered services and more. PACE program's been around a long time. However, in Michigan, it's only recently started to expand, and I'm really happy to see that, and we're seeing continued expansion. So if you do not currently have a PACE program in your community, there may be, because there is continued interest. Hopefully that would be something that would come to your community soon. I happen to live in a community that currently does not have a PACE program, but look forward to the day that we do. You can live in a variety of settings to receive the PACE program services, but you cannot live in a nursing home at the time you enroll. Basically, the PACE program is a capitated benefit or a managed care. And it's for people who are dual eligible, meaning they have both Medicare and Medicaid. And yes, you can have both. A lot of older adults are like, oh, I can have both? Oh, okay. Again, you have to meet that long-term care level of care criteria. For the PACE program, you can be 55 years of age or older, and then you have to live in that approved geographic area and live safely in your home. To me, I'll just describe PACE a little bit more in terms of how I view it. To me, it sort of has a mixture of a clinical side, because you receive all your medical services within the PACE program too. If you can imagine, you have your doctor, your nurse, your physical therapist, your social worker, all the disciplines. And so there's sort of a clinic side in it. And so when you think like doctor office look, okay? And not all are the same, but I'm just helping you visualize if you don't have it. And then there's also the sort of senior center or assisted living look side, where the person can come in for the day and have a meal, have socialization and activities. Now the PACE program covers all those Medicare and Medicaid services that we talked about earlier. So that means they provide the home health aide in the person's own home. So if they needed help getting up to get ready to go to the PACE program, day program, an aide would come to the home. They have transportation, so a vehicle could come and pick them up and take them to the PACE program. You do not have to go on site, but you can for the meals, socialization, and activities. But your doctor and all your healthcare professionals are, well, I don't literally mean necessarily housed there, but most are housed there. There are different configurations. So the real benefit to that program is that this medical team, they have direct contact with each other. They're housed right there and serve the same group of people. So if you want to learn more about the PACE program, I've provided that link, and you're more than welcome to see if there's one in your area. Find out more information. Okay, so now we're getting to nursing home. I know we're getting very close to the end, and we are getting close to the end. Paying for a nursing home, typically there's private pay, Medicare, Medicaid, long-term care insurance, or veterans benefits. I say this is the typical progression, again, just based on my personal experience. Not always, but a person doesn't always go to the hospital before they go to a nursing home, but frequently there's a hospital stay, admission to the nursing home under Medicare. The person pays privately if they exhaust their Medicare, when they exhaust their Medicare days, if they stay. They pay privately until they exhaust their resources, and then Medicaid will cover. Medicare benefits in a nursing home, Medicare will pay for that semi-private room, meals, skilled nursing and rehab services, and any other services. The Medicare requirement to be paid for a nursing home means that the person does have to be in the hospital first, and that means 3 days hospital stay, not including the day of discharge. And we have to watch a lot that those observation times in the hospital are not included. So if somebody was observed for 24 hours and never really admitted, it doesn't count towards that. So you have to be in the hospital 3 days, not including day of discharge, and you must require skilled care. It's important to know that Medicare will pay up to 100 days per benefit period, and that gets sticky and very detailed. But basically, the resident of the nursing home pays nothing for the first 20 days. From day 21 to 100, either the individual or their Medigap insurance, remember I said people with Medicare would buy a Medigap policy, would pay all the co-insurance of $161 a day. So even if I had Medicare A and B, okay, original Medicare, if I didn't have a Medigap, I'd be paying that $161 beginning day 21 through day 100. And then upon day 100, then I'm totally responsible for the bill. My Medicare and my Medigap will not cover that bill. Now, like I said before, it's important to note that it says up to 100 days, because that means if you are no longer skilled or do not meet the skilled criteria, Medicare will stop paying, even if that's day 15. Okay, so you're not necessarily guaranteed that 100 days. And sometimes there's a person who might be refusing therapies and those sorts of things, which would kick them off of skilled care. So what happens when Medicare stops paying? I just, did the math on the, I took the highest end for dramatic purposes on that, from that table. $464 a day times 365 days would be $169,000. So not too many people can afford the private pay for very long. So when you exhaust your Medicare days, you're responsible 100% for your care unless you have long-term care insurance. And what happens when I can no longer pay or have the ability to pay? Either my long-term care insurance or my Medicaid, I'm going to have to apply for Medicaid. Medicaid eligibility in a nursing home is very different for a single person rather than a person who's married. And the single person's income, as long as it's less than the private pay rate, so there's the income side, and then the asset side, again, I hesitate to say, but it's that $2,000, your home, your car, your burial, some excluded assets. Single person's patient pay means that they pay their monthly income to their nursing home less their health insurance premium, so they have enough money to keep up their health insurance premium, and less their patient needs allowance, which is about $60 a month, I believe now. Now, a person in a nursing home who has a spouse at home would need to do an asset declaration, which is completed the first day of a 30-day consecutive care. And that includes hospital and nursing home for that 30 days. And so a person needs to do that asset declaration the first time they're in the nursing home or hospital for 30 days, even if it's Medicare paid for and they go home. It will always go back, if they ever need Medicaid in the future, to that asset declaration for their initial 30-day stay. Spouse in the nursing home, oh, I'm sorry, I am really sorry, I have this mixed up. Spouse at home can keep $2,000. That's a big mistake. That is the spouse in the nursing home can keep $2,000. So please make that correction. The next one is the nursing home spouse can keep 1/2 of that initial asset assessment within some parameters. The lowest that they can be allowed is $23,844,000, and the highest is $119,222,000. So that would mean if my spouse and I had $25,844 and he was in the nursing home, we'd be eligible for Medicaid because he has $2,000 and I would be allowed to keep the $23,000, which is the floor. Now, if we had $100,000 between the two of us, he would be allowed to keep $2,000. I would be allowed to keep $50,000, because if we have 100, I get it's between that 23,000 figure and that 119,000. So I would get to keep $50,000 of our countable assets. Okay, so that just gives you sort of an idea. But if I had 500,000, I don't get to keep half because the maximum is 119. And it's very, very important to realize that we're talking about countable assets. A nursing home spouse's income is counted, but the spouse at home's income is not counted towards determining the patient pay. In fact, frequently a nursing home's resident's income can be diverted to the spouse at home. Same asset rules apply to the My Choice waiver program as it does a nursing home. I'm speeding up because here's how to locate a nursing home, and it's a nursing home compare again, and you can look at some quality care standards there too. Then finally, I'm going to go really quick, just going to sum this up because if there's questions. The NIFTY program is the Nursing Home Facility Transition Program. Basically, it has the same eligibility requirements as the My Choice waiver program, but it's for those people who are currently living in a nursing home and they want to return to the community. They're living in the nursing home under Medicaid. However, the Nursing Home Facility Transition Program does have some additional benefits to it, like helping with rent, deposits, and utilities, and debt payoff. That's all in that handout too. So that's available. And again, your area agency on aging is the nursing home facility transition provider, as well as another agency. Okay, I zoomed through those last few slides so I could give 60 seconds at least to questions.
Okay, we'll now open up the lines for questions, comments. So if you have any questions or comments, please state your site name first and then ask your question. So we'll open up the lines for either any audio or video either audio or video sites that have any questions. Go ahead.
I have a question. Well, first I want to say great program. And then for people who have Medicare Advantage, sometimes they don't have to have a hospital stay. They can go straight to the nursing home. But those Medicare Advantage plans, do they get up to 100 days too?
Yes, because they have all the same benefits as any other Medicare beneficiary. So you have the same benefits as any other Medicare beneficiary under original Medicare.
Thank you. It seems to me, though, at the nursing homes, they only like to give out 14 days at a time.
Oh,
they're pretty stingy.
Well, because they have to prove that the person is still needing, or provide verification that the person is still needing skilled care. And that's hard to project too far into the future. Yeah, so it's that's why I always tell people they hear that 100 days, they don't always hear the up to.
Are there any other questions?
Hi, this is Nancy.
Oh, go ahead.
Hi, this is Nancy in the Medicaid Waiver Program at A&D. And Brenda, I just want to say thank you for reviewing what Medicaid Waiver Program will pay for in assisted living. That is so often frustration for me when I'm working with folks. They get, like you said, maybe they get about $1,200, and they think they can go to an assisted living that costs, upwards of $3,000 a month. So I really, really appreciate you putting that out there for folks.
Right.
And I also, we have a PACE program in our area, part of our area.
Yes.
The Great Lakes PACE. And PACEs are developed where there is a significant population base. You have to meet certain standards.
Right.
I work, most of us that work in rural areas, PACE is probably not going to come to us anytime soon because you have to have a certain census or population base.
Right.
So,
well,
just wanted to make that comment as well, but thank you. Really good overview.
Great. Thank you, Nancy. Yeah, and I think that there's trying to be some look at some creative ways of meeting that population, that base by, I've heard some rumors of satellite different things and stuff like that. So I hope it gets to the rural areas because it is, in my opinion, such a great program. So thank you for what you do, Nancy.
I think transportation is a huge issue for most of us in rural areas.
Absolutely. Well, I want to thank all of you, and you do have my contact information. I really love helping folks out and understanding and connecting, so don't hesitate to give me a buzz or send me an email. I'd be happy to hear from you.
Are there any other questions or comments? We'll go from either video or audio. So if you have any questions from any video sites or audio sites, go ahead. If not, we'll go ahead and sign off. And thank you for joining us and have a great day.
Thank you.